Hello everyone and welcome to Module 9. This week we are focusing on urgent care, which will review back to a chapter I believe we've all read, which is chapter 43. You should have read this already in your fundamentals course, but this course it will be more of a how you as a medical assistant will handle it and how you will work with an urgent care system. So let's go ahead and get started this week. So urgent care is looking at and dealing with medical conditions and medical emergencies and your responsibility in those roles. As a medical assistant, you will need training in these areas to make sure that you are prepared, and anytime there is any sort of an emergency, the physician needs to be notified immediately. So urgent care is discussing and defined as medical care that accommodates patients who need to see a doctor now, but do not have a life-threatening condition warranting an emergency room visit. Urgent care facilities treat patients with conditions that need intervention as soon as possible, but not life-threatening. Typically, these facilities are open 7 days a week, and their hours will expand into the evening to accommodate those who work during the day. Now, when we start to really kind of look at and define this, it's important that you know that depending on the severity, you may need to contact other emergency services, such as EMR, emergency medical responders, EMTs, emergency medical technicians, paramedics, or even advanced medical technicians. When we look at and talk about medical emergencies, we also need to remember that with urgent care, we need to follow the Good Samaritan Law. Now, this shouldn't be the first time that you are hearing of the Good Samaritan Law, but we do go into a little bit more discussion on that. So the Good Samaritan laws were established to encourage healthcare professionals to volunteer in emergencies without fear of financial liability. This generally applies to situations both inside and outside of the medical office. And as a medical assistant, you typically have 3 primary legal responsibilities. Your first is to act within your scope of practice. Second is to ensure that you document the emergency consistently, and that you're always consistently ready in your office for emergencies. And third is to do all that you can to prevent emergencies in the future. So now there are some guidelines for providing emergency care, and as a medical assistant, you need to stay up to date on emergency plans of your office and facility. You may also need to handle emergencies that come in 3 main types of situations. This could be over the phone, near the physician's office, or in the building itself. When you are over the phone taking a call, you need to use what we call your triaging skills, and that means that you prioritize and assess the emergency and the needed care of the patient. You will also, when you're doing this, need to ask a few questions to get more information, such as patient's name, age, and gender. You'll also need to determine the patient's need for intervention. Try to obtain a history of the events. Gather as much medical and medication information as you can. Identify their allergies, and if they are in your facility or near your facility, you need to take vital signs. Now, every doctor's office will have an emergency crash kit available for situations. It will contain all the supplies needed during an emergency. It will instantly be accessible for anyone in the office, and the crash cart or close to it should be what we call a medical emergency drug box. Some drugs that you may see in there are activated charcoal, Benadryl, epinephrine, insulin, lidocaine, nitroglycerin, and normal saline. It will also have intubation equipment, a resuscitator or an AED, a heart monitor or a defibrillator. They can have oxygen or an airway or suction device. So now let's go ahead and get into some of the medical emergencies that you might encounter when you're training. And hopefully you remember your training from last quarter when you learned first aid and CPR. I'm not going to talk about first aid, but I will talk about respiratory distress. This could be a reaction to a long-term disease such as asthma or COPD. It could be due to an emergency situation such as anaphylactic shock due to a medication. And as a medical assistant, you need to be able to recognize the signs and symptoms of when someone does have respiratory distress, and you may be asked to administer oxygen to them to get them breathing as quickly or as appropriately as quickly as we can. You might deal with somebody who has hyperventilation, or even somebody who has gone into shock. So we're going to go into these a little bit further. We're going to talk about some non-life-threatening emergencies. So the first one that we hear of is shock or chest pain. And most people think, oh, well, chest pain is life-threatening. Well, not necessarily all the time is it. But chest pain can lead to heart attacks, which are the leading cause of death for both men and women. As a medical assistant, you need to be able to notice those signs and symptoms so you can get treatment and help to them right away. If a patient complains of middle or left side chest pain, describes it as sharp, stabbing, crushing, or squeezing, you need to get them help right away. If the patient calls you and they're telling you that they think they're having a heart attack, keep them on the phone, have a coworker call 911, and try to get as much information as you can from them. And then stay on the phone with them until EMS services do arrive. You could have someone who goes into shock. And shock is a collapse of your cardiovascular system. And it is caused by an insufficient cardiac output. You could have diabetic patients. And some of those diabetic emergencies where they're either having a low blood sugar or high blood sugar. It's important that you keep a glucometer close so if you need to, you can check their sugars quickly. You can deal with bleeding, which can be either internal or external. External bleeding is where your skin is broken, and this is a much easier type of bleeding to deal with. You want to apply a pressure bandage to the injured part and maintain pressure on the site until the bleeding has stopped. If bleeding seeps through, add a new bandage, but do not remove the first. Internal bleeding means that there is tissue damage with the intact skin under your organs or around your organs. This type is unlikely to be diagnosed in a medical office, but if you suspect it, get them treatment right away. You could also be dealing with open wounds. These are seldom life-threatening unless they penetrate the head, chest, throat, or abdomen. If those do occur, you need to contact the EMS services right away. Most of the time, if the injury is not life-threatening, you can irrigate it, debride it, suture it, and give antibiotics based off of the provider's instructions. For open wounds, there are some wound care pointers. First and foremost, you always apply a dressing that is sterile, covering the place directly over the wound to absorb any blood or bodily fluids. And the bandage will have what we call strips of binding, or use some strip of binding, to hold the dressing together. For example, either roll gauze or elastic gauze. Some other non-life-threatening injuries could be burns, which is a type of injury that occurs when an area of a tissue is destroyed by the action of physical heat, chemical activity, high electrical current, or heavy exposure to radiation. The severity of the burn depends on the amount and the depth of tissue injured. When you're treating burns, you want to use cool water to soothe the area if there's no broken blisters. Burns should be dressed with a dry, sterile dressing, and pain should be managed with injectable analgesics as ordered by your provider. You could be dealing with hyper or hypothermia. Hyperthermia is when you have prolonged exposure to heat and your body temperature reaches higher than 105 degrees in temperature. Hypothermia is the opposite. It's when you deal with low or cold exposures for a long period of time and your body temperature drops below 95 degrees. You could deal with a patient who has fainted or has had seizures. So those are things that you also have to deal with. If a patient does have a seizure, let them have the seizure. Do not touch them. Do not put anything in their mouth. Just make sure that they don't injure themselves. Then if you need to, you can apply and do any sort of emergency care techniques after they've woken from the seizure. In any situation, you have to be prepared for an emergency. And knowing that means that you know how to respond to an event, whether that be human-caused or natural-caused disasters. The number one thing that I can tell any of you is that in any situation, in any sort of care that you are working, you want to make sure that if there is an emergency, you remain calm. You don't want to overwork yourself and get yourself worked up, because then that will work up your patients. And trust me, that is not what you want to do. You don't want to handle any sort of crazy patients. You want to stay as calm as you can. Some examples of medical emergencies or emergencies that are natural based are earthquakes, tornadoes, hurricanes, fires, floods, and terrorism. Floods are actually what FEMA determines is the most common cause and most common emergency that people will experience in their life. So just be cautious of that. Alright guys, that is the rough overview I have for chapter 43. As always, I'm going to tell you that it is so important that you read your chapter in full, so that way you can actually have a better understanding of how to handle your discussion board, your lab class for the week, and also your quiz. You have one discussion board this week, which is talking about triaging skills and who goes first. So it gives you a little scenario about an accident that has occurred, and there's a group of about 10 people coming to your emergency care clinic. What you need to do is you need to determine how you're going to prepare for the situation at hand. What is your plan for treating these patients? What would you consider resources or extra help, and how can they be useful? You'll need to discuss what kinds of supplies that you will need to make sure that you have ready and available. And then you're going to take some time and look at the patients that are coming in and tell me and your classmates in what order would you see your patients and why. Okay? You need to reply to at least one student or classmate no later than Saturday, September 2nd. Make sure your initial post is due no later than Tuesday, August 29th. Then you'll have your one quiz for the week, which again is back to the 10 multiple choice questions with a 10-minute time limit. This will be due Sunday, September 3rd by midnight. Alright guys, that's all I have for this week. If you do have any questions, comments, or concerns, please make sure that you are reaching out to me, either course messaging in Blackboard or sending me a phone call to the Rockford campus. My direct line can be found on your course homepage in the top right-hand corner near my photo. I hope you all have a wonderful week 9 and enjoy what all urgent care has to offer for you guys. Bye-bye.